Hello friends, today we are going to discuss about alcohol dependence. Both I'll be comparing ICD-11 and DSM-V diagnostic category. Alcohol dependence is also considered as alcohol addiction, but addiction is a old term and also it has a lot of stigma and discrimination involved. Hence, either the people call it as alcohol use disorder or alcohol dependence. I'm Dr. Suresh Padadmat, Professor of Psychiatry, working at NIMHANS, Bangalore. As we know, there are two important category systems across the globe. One is ICD-11, that is by World Health Organization. Currently, it is the 11th edition. The second most commonest category is American Psychiatric Association Diagnostic and Statistical Manual of Mental Disorder 5th edition. So let's understand how these both the categories discuss and also diagnose alcohol dependence syndrome. Alcohol dependence syndrome under ICD-11 comes under Chapter 6, that is mental, behavioral or neurodevelopmental disorders. So this is the Chapter 6 under ICD-11. In that again, there is the subcategory disorders due to substance use or addictive behaviors. You need to understand there are two important categories have been made. One is substance use, another one is addictive behaviors. Let's understand each one of them. Here, substance use means there should be a psychoactive substance such as alcohol, morphine, pethidine, cocaine, cannabis. So these are all psychoactive substances. But the second category, that is specific, repetitive, rewarding and reinforcing behaviors such as gambling, where there is no substance but the person becomes addicted, or compulsive gambling is the old term used, or else gaming. Nowadays, children are becoming addicted to games. So this is addictive behaviors. So these are the two categories which have been diagnosed under ICD-11. Let's recapitulate the whole thing. The substance use, that is drug abuse, has been categorized into two. The first one is disorders due to substance use. They're all basically psychoactive substances. Second one is disorders due to addictive behaviors, that is gambling and gaming. Let's look into each one of them now. If you look at the disorders of substance use, there are 14 substances have been made from alcohol, cannabis and various other substances. Now let's look into the importance of each substances. If you take alcohol, cannabis, cocaine, each of the substances can form, these are the disorders they can form, like from episodic harmful use to harmful pattern of abuse, substance dependence, intoxication, withdrawal, delirium. So in this video, I'll be discussing of substance dependence. Let's understand about substance dependence. That is, I'll be discussing alcohol dependence here. In the alcohol dependence, as per DSM-V of US, they report in their population, 5% of the population are dependent on alcohol, or in lay term, 5% of the population is addicted to alcohol. Now what about Indian study? Indian epidemiological survey have said that around 2.7% of our population are dependent to alcohol. That is, in India, if it is 130 crore population, 2.9 crore people are dependent on alcohol. That is, 2.9 crore people addicted to alcohol and 2.9 crore families are suffering because of this substance dependence. I'm talking about addiction, but what about the harmful users, the people who use alcohol and create trouble, or problematic users is the simple term. That is 5.7 crore. That is 5.2% of our population. So it's a huge public health problem at this point of time, even in India. Let's look into what is alcohol dependence. We are worried about the illness pattern which we need to address at the earliest. As per ICD-11, that is World Health Organization's International Classification of Disease 11th edition, we will look at when we can make the diagnosis of dependence or addiction. The dependence can be categorized when there are two or more following symptoms are there. Let me tell you, two or more symptoms which are there for at least 12 months. Or else, if the person is drinking at least for 3 months continuously on daily basis, then also you can make addiction. What are those at least two symptoms should be there? First one is loss of control. That means he is unable to control the amount of substance he takes. He says, I will go and take only half a quarter, but he ends up taking 4 quarters. He says, today I will not going to take alcohol, but he ends up taking alcohol. That means he is unable to control his urges, or he is unable to control the amount of substance he is taking. That is the first criteria. Second one is increasing precedence of alcohol use over other aspects of life. That is salience. That means the person's life is revolving around alcohol use. Even if he has to go for a job, he will take alcohol. If he has to go for his child's birthday, he will take alcohol and go. That means his all other activities will be preceded by the substance use. That means he neglects all other activities which gives him happiness or pleasure, becomes secondary, and alcohol becomes the primary pleasure. That is the second criteria. Next is physiological features, also called as neuroadaptation. First one is tolerance. Tolerance means if the person has to get the same high, he has to increase the substance of intake. That means if he used to get the high with 1 quarter today, if he continues to take, at the end of 6 months, he need to take 2 quarters to get the same high. Over a period of 2 years, he has to take 4 quarters to get the same high. That means his liver is getting activated. His enzymes are becoming more professional in dealing with the alcohol. Hence, you need to take more alcohol to deal to get the same high. That is tolerance. The next one is withdrawal symptoms. If the person does not take alcohol at the right time, he will start having withdrawal symptoms like restlessness, irritability, panic attacks, becoming very angry. So withdrawal symptoms, including tremors, will be there. The third is repeated use of substance use to prevent withdrawal symptoms, because now he says, if I don't take alcohol, I'll become different person. So I have to take. That means one is withdrawal symptoms is there. Another one is to prevent withdrawal symptoms is drinking alcohol. So if any of these two symptoms are there of the above for a period of 1 year, then it is called as dependence. Or else if the person is taking regularly for 3 months and he gets any of these two symptoms, then also it could be made as alcohol dependence or addiction. However, there are core specifier. That means alcohol dependence is a lifetime diagnosis. That means once the illness comes, it will be diagnosed as alcohol dependence syndrome or alcohol addiction. It is in continuous use, or else is in episodic. He takes alcohol for 6 months and he stops. Again, next year he will take for 6 months. That is episodic course. One is continuous. He has not stopped. He is drinking almost every day from past 8 years. That is continuous. Next one is alcohol dependence, early full remission. That means he has stopped alcohol for past 1 to 12 months. That is early full remission. Alcohol dependence, sustained partial remission. That means he does not fulfill the criteria of dependence in the past 1 year. Alcohol dependence, sustained full remission means he is abstinent from alcohol for more than 12 months or longer. And the other one is unspecified. This is basically if the person does not meet above of the criteria, then it will be considered as unspecified. This is how the ICD-11 categorizes. But it also gives some additional features. What are those additional features? You can ask for the patient whether the person has craving. That means irresistible urge to take alcohol. The withdrawal symptoms are already mentioned in the criteria. The next one is tolerance. That is varies based upon the use of substance. Next one is physical health consequences. If the person is taking alcohol, invariably it will have a direct effect on the liver. Whereas if the person is taking cocaine, it will have a different effect on the brain. So depending upon the substance used, and it may have a specific affinity towards an organ. Physical consequences occurring because of substance use, like it may have effect on the work, maybe economic, maybe family, on the friends. Finally, the person may also have a comorbid psychiatric and also medical illness. So that means the person not only have alcohol dependence or addiction, he may have one more psychiatric diagnosis. For example, if a person is depressed, to overcome depression, he will start drinking. The best example is, I am sad because my child died. I am sad because my father died, so I will drink daily. So that is a self medication. Another one is anxiety. A person says, I'll become very anxious if I don't drink. So I have to drink. So that is the anxiety disorder perspective. Now let's understand alcohol dependence or alcohol use disorder from DSM-5. As I mentioned earlier, alcohol dependence or alcohol addiction is the same term in DSM-5 as alcohol use disorder. Here, Americans wanted to abandon this definition or the word addiction or dependence. They would like to use this term called as alcohol use disorder because it gives early diagnosis. It brings in the concept of spectrum. Even the early signs of diagnosis, you can start intervening. At the same time, the person can approach for treatment without having dependence, so that even the insurance company has to give the reimbursement. Let's understand DSM-5 diagnosis of alcohol use disorder or alcohol dependence. Here also it requires at least 2 symptoms out of 11 over a period of 12 months. But however, DSM-5 does not allow to diagnose within 3 months, whereas ICD-11 gives that in DSM-5 it has to be 1 year and 2 symptoms. And the symptoms can vary within this 12 months. That means he may qualify for 2 symptoms now. Maybe after 4 months there may be another 2 symptoms or 3 symptoms. So mix and match is allowed. Let's look into this 11 symptoms. These 11 symptoms can be categorized into 4 important groups. First one is impaired control over substance use. Second one is social impairment. Third one is risky use. And the fourth one is pharmacological symptoms. Let's look into each group and see how these 11 symptoms have been grouped. The first one is impaired control. Impaired control of substance use means he consumes more alcohol or spends more time in drinking than intended. That means he wants to take only half a quarter, but he ends up taking 1 quarter. That means he wants to go and limit himself, but he's unable to limit and he's unable to control it. That is the first one. Second one is wants to limit or halt the alcohol, but he hasn't succeeded. That means many of the patients says that I want to stop, but I am unable to stop it. So that is, he tried to stop it, but he's not succeeded at all. That means attempts to cut down is not working. That means it is also loss of control. Third one is he spends a significant amount of time obtaining alcohol, drinking alcohol, recovering from alcohol consumption. See, it's a very beautiful criteria. Many of the patients or person, when they come to know alcohol is not available, they will go any amount of distance, maybe 5 kilometers, 10 kilometers to buy the alcohol. That means they spend time in procuring, they spend time in drinking, and then they go into a state where they had to spend around 10 to 20 hours to recover. That is significant amount of time is spent in drinking or recovering from alcohol. And the fourth one is craving of alcohol. That is irresistible urge to take alcohol. So these are the 4 criteria which comes under loss of control or impaired control over substance. Moving to social impairment. Here, the person is unable to fulfill certain obligation in the society. First one is he had or suffered consequences at home, school, because of recurring alcohol use. That means he has a problem at home or in the school. This is basically targeted to the young kids who are going to school and colleges. The other one is has suffered relationship problem due to recurring alcohol use. Here, the parents may become very irritated because of his alcohol use, or his spouse or maybe boyfriend or girlfriend, or even the friendship is getting sour because of the alcohol use. Third one is has given up or cut back on enjoyable activities due to recurring alcohol use. That means he does not want any other pleasurable activities, but he spends time in alcohol use. That means his pleasure activity revolves around only alcohol use. He does not want to spend time with the friends or family or anybody else, or even wants to go for a trip. He will go for a trip after taking alcohol. So that means his pleasure activity is only alcohol, nothing else. Even if his wife says that if you have alcohol, you cannot come near me, he will say, I would like to have alcohol. That means even alcohol gets preference over sex. So that is the amount of dependence or addiction occurs. Coming to risky use. The risky use is basically using alcohol in a physically dangerous situation, such as drinking and driving, unprotected sex, drinking alcohol and doing job. Maybe he may be a doctor doing surgery, or else he may be a person working in a factory under difficult circumstances, using heavy machineries, and he is intoxicated. That is the risky use. Further, he continues to use alcohol despite knowing it is causing physical and psychological harm. The doctor has told him, if you take alcohol, you will have liver problem, you will have heart problem, you will have renal problem. You need to stop. That means in spite of having the knowledge that it is causing harm to his health, but he continues to drink. That is risky use. Coming to the last one, pharmacological impact. Here, as it has become increasingly tolerant to alcohol, that means to get the same effect of alcohol, he needs to take more alcohol. That means earlier he used to take 1/4 and he used to get high. But nowadays he has to take 2/4 to get the same high. That means his liver is breaking down the alcohol very fast because of the induction or enzymes have been induced. Next one is withdrawal symptoms, because if he does not take alcohol, or else if he decreases the alcohol, within few hours to days he will have withdrawal symptoms. So he out of these 11, if he has 2 symptoms for a past 1 year, then you can make a diagnosis of alcohol use disorder or alcohol dependence or alcohol addiction. These 11 symptoms is not only for alcohol, for cannabis, cocaine, opioid, or any other. You can call it as ecstasy, MDMA, amphetamine, any drug. Out of these 11, if he has 2 symptoms, that will be called as alcohol use disorder, or it will be called specific substance use disorder, like cannabis use disorder, cocaine use disorder, opioid use disorder. It will be called. Out of 11, if he qualifies for more symptoms, the severe is the problem. Summarizing the alcohol use disorder, it has first one is craving, tolerance, withdrawal symptoms, salience. Salience means his pleasurable activity is only alcohol, time spent in procuring, recovering from the effect of alcohol, loss of control, unable to cut down or stop the alcohol use, harmful use. That means in spite of knowing that it is affecting his physical health, he continues to drink. Impairment at work. He knows that his job is getting affected, but he continues to drink. Relationship issues, using alcohol in a dangerous situation. Out of this 11, if he has 2 symptoms over a period of 1 year, you can call it as an alcohol use disorder. So, as I mentioned, depending upon the number of symptoms, the severity increases. If he has 2 to 3 symptoms, it is called as mild disorder. If he has 4 to 5 symptoms, it is called as moderate. And if he has 6 or more, it will be called as severe alcohol use disorder. That means more the symptoms he has, more severity it is the dependence. As I mentioned earlier, there are core specifier. Early remission, that means he's been away from alcohol for past 3 to 12 months. Within the 3 to 12 months, it is called as early remission. Partial remission means it has been over 12 months since the person has met the alcohol use disorder. Now another one is in controlled environment. That means he's admitted to the rehabilitation center and he's not getting access. So these are the core specifier has been mentioned under the alcohol use disorder. Now let's understand and know about the structured assessment. How do we do the assessment about alcohol use disorder or any other substance use? But here I'll be focusing more on alcohol. One of the WHO simple screening tool has been formed, that is AUDIT. A for alcohol, U for use, D for disorder, I for identification, and T for test. So it is simply called as alcohol use disorders identification test. It is called as AUDIT. It has 10 items only. That means if you are able to use these 10 items, you'll be able to make the diagnosis of alcohol use disorder. There are two important versions available. That is clinician administered. That means the doctor will administer the scale to the patient. Where the patient is illiterate, does not know how to read English, there you will be using it. However, if the patient does not know how to read, or he knows how to read, he will be using self-report version of AUDIT. However, this AUDIT is a free version available across the world free of cost. It has been translated to many languages and also has been standardized for the respective language also. In these 10 items, a score of 8 or more will be considered as harmful or hazardous use of alcohol who requires intervention. If it is 7 or less, just a psychosocial education or just giving a counseling is more than enough. Let's look into each one of the item out of 10. In the interview version, there are 10 items. Each item will be scored from 0 to 4. In the first one, the first question is, how often do you have a drink containing alcohol? Never, that is 0. 1 will be monthly. 2 will be 2 to 4 times a month. 2 to 3 times a week is 3, and 4 is 4 times a week. So in this way, you are going to clearly make the rating. So however, if the person does not drink, you will skip to 9 and 10. So the first question has a skip. You will ask 1. If it is never, go for 9th and 10th question. If he says monthly I am taking, you will move towards the second question. How many drinks containing alcohol do you have on a typical day when you are drinking? That means whenever you drink, how much you drink? 1 or 2 unit, 3 to 4 unit, 5 to 6, 7, 8 or 9 or 10 or more. 1 unit means 30 ml of hard liquor or else half a bottle of beer. Here half a bottle means 750 ml or 700 ml. So that is called as 1 unit. Third one is, how often do you have 6 or more drinks on an occasion? That means even if he drinks occasionally, he drinks 6 or more. That means more than 180 ml. 180 or more 180 ml. That is 1 quarter or more. That is 30 ml 1 unit. 6 means 180 ml. So never. Less than monthly is 1. Monthly is 2. 3 will be weekly. 4 is daily or almost daily. So again you have a skip question 9 to 10. If the total score, if this question is 2 or 3 is 0. Now moving to 4th. How often during the last year have you found that you were not able to stop drinking once you had started? That means difficulty in controlling. Again that you will be asking the question. 5th one is, how often during the last year have you failed to do what was normally expected from you because of drinking? That means he's supposed to go to work, he's supposed to pay the children's school bill, whether he's able to do or not. 6th one is, how often during the last year have you needed a first drink in the morning to yourself going after a heavy drink session? That means every morning, how often he is drinking? That is the question. That means eye-opener drinking. 7th one is, how often during the last year have you had a feeling of guilt or remorse after drinking? That means the person takes alcohol and next morning he feels that I should have not drunk so much. He's feeling guilt. He's feeling remorseful. 8th, how often during the last year have you been unable to remember what happened in the night before or because of drinking? That means blackout. Because he has drunk so much, he does not able to remember what happened in the night. 9th one, have you or someone else been injured as a result of your drinking? Because he is taking alcohol, he has met with an accident, he injured himself or he has injured somebody else. So that is the question. 10th one is, Has a relative or a friend or a doctor or any other health worker has been concerned about your drinking or suggested you to cut down? If the family member says you should stop drinking, or the doctor has told you, friends have told you, relatives, so that is the score. So this interview version, you have to add all of them and place in the final total number. Again, I'll tell you, audit is a freely available tool. It is available online. You can just type audit on Google. You can get this, and you can use it for in your clinical practice. That is about the clinical administered. Suppose if you are a doctor where your patient is an educated patient, you can give this printout to him when he is sitting in the clinic. Ask him to fill this, and now after filling, you can count and see to what extent he is having problem. So after adding, if here the minimum score for audit is 0, maximum is 40, because there are 10 items, maximum score is 4, 10 into 4 is 40. So harmful use is 8 to 14, and dependence addiction is if he scores more than 15. Anything more than 15 is a dependence. He needs even medication for treatment. For harmful use 8 to 14, it's more of counseling. Let's look into the management as per the audit score. If the audit score is between 0 to 7, is very low risk, need not worry. You need to give feedback and say anytime you may enter into the range of harmful or addiction place. The second is, if he scores the audit between 8 to 14, you need to give counseling also here. Ask him to come every month for next 3 to 6 months and keep him under observation. The reason is, at any time he may develop into dependence. That warning you have to give, feedback has to be given, and if required, brief intervention. It may be family intervention. All the family, discuss with them how we can stop further moving into dependence or addiction. Suppose he is in the 15 or more. Here, not only counseling and feedback, he needs to be sent to a specialist. He needs to undergo detoxification, that is, medicines is required, and long-term relapse prevention medication has to be given. So that is the seriousness of this audit. But however, sir, I'm a busy primary care practitioner. I see around 100 patients per day. I can't administer 10 questionnaire, 10 items, which will take around 10 minutes. Instead of that, is there any easy way? Yes, there is a simple audit which has only 3 items. The 3 items are: how often do you drink containing alcohol? So there. Next one is, how many standards of drinking containing alcohol do you have typical day? That is the second. How often do you have 6 or more drinks? If he has 4 or more, you need to use the complete version and see the severity, especially in male. If it is 3 or more in female, again you have to use the complete version, and then you will be able to do this is called as audit concise version or screening version. But further, there is one more, a simple cage questionnaire. That is, C stands for cut down, A for annoyed, G for guilty, E for eye opener. So this cage questionnaire has 4 items. If you are asking these 4 items, and then you will be rating it. So the first question for C: have you ever felt you should cut down on your drinking? That means anytime you are drinking alcohol, you felt that you should decrease or stop. That is the one. Second one is yes, means that means he is in a serious risk. Have people annoyed or you by criticizing for your drinking? He would have been given a feedback by his friends, you drink too much. Or your girlfriend or a boyfriend has told you are drinking too much, you need to stop. Or your family members. So annoyed because or criticizing because of your substance use. That is another important. Have you ever felt bad or guilty about your drinking? That means after drinking, why did I drink? Why did I do this? That feeling of remorse and guilt, if it is there. Last one is eye opener. Early morning he feels for drinking. That is, have you ever had a drink first thing in the morning to study your nerves or to get rid of hangover? Here you have to be very clear. Eye opener means here he is in the serious situation. Out of this 4, so for every no it is 0, for everyone yes. If he is scoring 2 or more, that means He is a clinical significant, he requires treatment. Higher the score, worse is the problem. Now let's understand about management of alcohol dependence. How do you manage them? The first and the foremost is you do a thorough general physical examination, look for icterus, look for hypertension, diabetes. Does he have any physical injuries on the body? That is very essential. Look for any anemia he has. Look for any other ascites, any bleeding per annum, or as blood, alcohol vomiting. Those kinds of any physical problems are there you need to do. If there are no physical issues, no jaundice or icterus, he will do some of the investigation. Hemogram, liver function test, it includes serum bilirubin, SGOT, SGPT. Renal function test, RBS, electrolytes. Based on the other comorbidity, you can do investigation. Suppose he has a head injury. He has taken alcohol yesterday and he has fell down or he is met with an accident. Relevant CT scan, X-ray may be required. Suppose he is having cognitive deficits. That means he is forgetting things. He may require MRI also. So based upon the comorbidities, you may take. Suppose he has chest pain. You may have to consider echo, ECG, maybe even cardiac angiogram. The treatment has two important things. One is short term, another one is long term. Short term is detoxification. That means to overcome the withdrawal symptoms. If a person stops alcohol, he will have severe withdrawal, such as anxiety, panic attacks, sweating, flushing, irritability, decreased sleep, anger, and his irresistible urge to take alcohol. He wants to run towards the alcohol stores. He becomes disoriented sometimes. He may have seizures. To decrease these withdrawal symptoms, we have to do detoxification. The drug of choice is diazepam. Either you can choose long-acting or short-acting. Preferably you choose long-acting based upon if he doesn't have any liver problem. Whenever there is no liver problem, that means he does not have any icterus, choose long-acting. No sir, there is some issues with the liver function test. He has icterus, then you have to choose oxazepam. So based upon the comorbidity, you will choose. But by default, diazepam is the best. Based upon the withdrawal symptoms, you will choose the diazepam and dosage. After you do the detoxification, you will shift over to long term. That is relapse prevention. Here either you will choose disulfiram, naltrexone or acamprosate. Now let's discuss each one of them. Short-term treatment. As I mentioned, in short-term treatment, detoxification, benzodiazepine is the drug of choice. There are three methodology to know what is the dosage of benzodiazepine. One is fixed dosage. Whatever the amount of alcohol he takes, he will choose either 15 mg or 30 mg of chlorodiazepoxide or else 10 to 20 mg of diazepam 4 times a day. So this is a fixed dosage approach. Either you will say, I will give 10 mg 4 times a day so that his withdrawal symptoms is under control. Next one is symptoms trigger dosing. Here, whenever he has withdrawal symptoms, he will give 10 mg. So that means based upon his withdrawal symptoms, that is insomnia, tremors, anxiety, you will give 10 mg or 20 mg of diazepam. Whenever he has these symptoms, he will give. So symptoms triggered dosing is the second one. Third one is front load dosing. Here, as soon as the patient comes, to make him comfortable, based upon the units of alcohol use, you will give 30 to 40 mg of diazepam. And then whenever he has withdrawal symptoms, you will give 10 to 20 mg of diazepam. So he has a combination of fixed loading dosage and symptom triggered dosing. That is the short term. But at the same time, you also have to give symptomatic treatment. 250 mg of thiamine parenteral can be given once a day over a period of 3 to 5 days. Many a time, thiamine may not be available. You may have to give 100 mg IM or IV. So after that, orally, thiamine has to be given over a period of 3 months. Other supportive treatment like IV fluids, gastritis to be taken care, electrolytes and other any pancreatitis, any other comorbidity should be taken care. Now, once you are done the detoxification, that means Once your fixed dosage has been established, he is taking 40 mg of diazepam per day and his withdrawal symptoms are controlled, from next week onwards, you will start decreasing 25% every week. That is the best strategy on OPD basis. That means if he is on 40 mg, next week you will reduce it to 30 mg. That means 25%, 10 mg will be reduced. Third week, you will be reducing into 20 mg. Then fourth week, 10 mg and 5 mg and you will stop it. That means slowly taper and stop the medication. That is detoxification to be stopped. That means 25% of the dosage should be decreased every week. 25% of the total dosage. Okay. Now going to the long-term treatment. Either you can choose a composite, disulfiram, naltrexone. It should be given at least for 1 year. Sir, which one is the best? If you ask me, the best way is to choose is, in India, the cost of the medication. Disulfiram is very economical brand. It is available easily. So 250 mg per day can be given. But you need to explain. If you take disulfiram and alcohol, you will have disulfiram reaction. And you need to come to the hospital immediately. No need to worry that your life will not be under threat, but you will not get a kick. You will be kicked by taking disulfiram. That means you will have severe vomiting. You will have panic attacks. You will not be able to sleep. You will be having a headache. So that is disulfiram reaction. Or else you can take naltrexone. 50 mg per day, it will cost around 30 to 40 rupees per tablet. Here, no side effects, but he will not get the kick with the alcohol. He has to take more and more dosage, but it will be, again, he may go into alcohol poisoning. So naltrexone is 150 mg. So he should not take this medicine and drink. Another one is acamprosate, which decreases craving. If he is less than 50 kg, he will give 1332 mg per day, or else if is more than 50 mg, you will give 2 grams per day. Along with this, you will do family therapy, individual therapy and other psychosocial treatment. This to be considered for last 1 year. At least 1 year you have to give. Please remember, who has the best outcome? The patient who meets the doctor regularly, that is, he comes for follow-up regularly, he has higher chance of quitting alcohol. To conclude, my dear friends, alcohol use disorder is around 5% in the population. 95% can be treated in primary healthcare center and they can be treated by the primary care physician. 2 to 3% only require ICU care because of seizures and delirium tremens. I'll be doing a separate video on the seizure and DT, how to manage them. Alcohol use disorder is a chronic, relapsing, remitting disorder. Usually the literature says 6 to 7 detoxification is required to quit the alcohol. That means you will be having frequently relapsing condition and you need to prepare the family for relapse. As soon as he takes alcohol, bring him for treatment. First time when you give treatment detoxification, he may be dry for a period of 3 months and he may drink again. Bring him back. Give a treatment. He will now be dry for next 6 months. So that means slowly the remission period increases. So being in touch with the treating team plays a crucial role in the outcome. So the long-term treatment of goal is to see how we can keep him away from the alcohol for longer duration of time. Please remember, relapse is by default. That means relapse is the rule, but treatment should continue. Thank you very much for giving your valuable time. Stay safe.